Well, good afternoon, everyone. Thank you for joining us today. I am Erin Walton, Executive Director of Resilience, and I am excited to welcome you to our first Celebrating Resilience Speaker Series event. The goal of this new speaker series is to share information and inspiration on topics that are important and relevant to our community. It is our hope that with each conversation, you are empowered and encouraged to invest in yourself and in others. So before we get started, I have just a few housekeeping announcements to make. Following Dr. Clark's presentation, we will have time for questions from the audience. You will have two options. You can put your questions, type your questions in the chat box at any time, and a member of our staff will read your questions on your behalf during the question and answer portion of the program. Or if you prefer to ask your question directly to Dr. Clark, we welcome you to do that as well. Let us know in the chat that you have a question, and we will unmute and introduce you at the appropriate time. Questions will be asked in the order in which they come into the chat, and we will do our very best to address as many questions as we can within the hour. If you need support or someone to talk to following today's conversation, we have members of our therapy team available to talk to you. You can reach a member of our team by dialing our office number 312-443-9603. We will also have that number in our chat box. Additionally, a list of resources will be provided on the screen at the end of the event and will also be included in the chat box. We encourage anyone that needs our help to reach out to Resilience or to either of the resources that we provide. Lastly, this event will be recorded. All right. Resilience was founded in 1974, over 46 years ago, by Dr. Natalie Stevens because she saw firsthand the impact that trauma, specifically sexual violence, has on the survivor's mental health and emotional well-being. Today, folks everywhere are being impacted by numerous strains on our mental health. COVID-19, civil unrest, unemployment, underemployment, political infighting. It has all touched every one of us in some form, directly or indirectly. And we at Resilience, we can't forget that while all of these things are happening, sexual violence has not stopped. Statistically, we know that sexual violence has likely increased while we've been under stay-at-home orders, particularly for those in homes and relationships where violence already exists. So today's discussion on mental health, wellness, and learning to be resilient in our current environment is indeed relevant for all of us. So let's get started on this important conversation. Dr. Crystal T. Clark is an assistant professor of psychiatry and behavioral health sciences, and she has a secondary appointment in obstetrics and gynecology at Northwestern University Feinberg School of Medicine. That's a mouthful. She is board certified in adult psychiatry. Dr. Clark's expertise includes the treatment of mental health in women broadly across their lifespan, and specifically as it relates to the diagnosis and treatment of mood and anxiety disorders affected by hormonal changes during periods such as pregnancy, postpartum, and menopause. Dr. Clark has served as an expert on mental health topics such as suicide, medication, substance abuse, and new drug therapies for several media outlets, including National Public Radio, New York Times, ABC 7, and Chicago Tonight. And we are thrilled on top of all of that to say that she's also a member of the Resilience Board of Directors. Please help me welcome Dr. Crystal Clark.
Well, good afternoon, everyone. It is a pleasure to be here and be part of the Resilient Speaker Series, and mainly because, as Erin just mentioned, and thank you, Erin, for that wonderful introduction. But as Erin just mentioned, I am a member of the board of directors, so I believe greatly in their mission and the work that they are committed to, and it is just a pleasure and an honor to be here. It's also an honor to be here because we're going to talk about something that I'm very passionate about, and that's mental health. And that makes sense as a psychiatrist, right? I've devoted my career to it. And it's so important, it's so critical in this unprecedented year. As Erin has so nicely and eloquently stated, we're dealing with so much, the pandemic, the political infighting, the civil unrest. So many things have been going on this year. It's just been unbelievable. And I don't know about you guys, but I felt like this year has gone on for a decade. So, you know, even though it started in March that we were dealing with this, it feels like it's been a decade. So I want to take the next several minutes before we get into a deeper discussion, just to highlight what has gone on exactly in the pandemic that affects our mental health, how we can maintain mental wellness, recover from mental illness, and also how those things impact our resilience. So let's start with the COVID pandemic. 2020 has been unprecedented in that regard. We have been dealing with the COVID pandemic in Chicago at least since March. I personally remember going home on March 15th and haven't returned to work yet. I've been working remotely this entire time with occasional going into the office to see patients, but most commonly being at home right where I'm sitting today. But what has that meant, that being remote, working remotely, what has that meant for us and for those who can't work remotely? Well, that means that many have been on the front lines that aren't able to work remotely, dealing with the fears and anxieties of bringing this infection home, of trying to keep themselves safe, keep their family safe. And for those who are working remotely, it's meant some degree of isolation. Anyone who's believing in this pandemic and taking the precautions for this pandemic have been dealing with some sort of isolation. We have been mourning, absolutely mourning simple things like human touch, hugging your grandmother, your mom, your sister, your best friend, trying to, again, keep them safe. We are missing out on the things that would normally be distractions, but also coping mechanisms, right? The celebrations of life, like weddings, birthday parties, baby showers, honeymoons. You know, we can't do any of those things right now. Just a good vacation. I know I'm missing that somewhere else outside of Chicago. But we've also dealt with greater losses, unemployment, just economic distress, losing so many people across our country and across the globe, actual lives. And on top of losing the lives, we aren't even able to bring closure to our grief in an appropriate way. We aren't able to gather for funerals. Those of us who are religious or spiritual aren't even able to get together in churches safely. So we have been dealing with a lot. And what does that mean? Well, for our mental health, it's wreaking havoc. You know, we are definitely dealing with a time where mental illness is on the rise. In fact, mental illness during this year is 40% greater than it was last year, meaning that 40% more people are reporting or being diagnosed with anxiety, depression, or substance use. Some of it new onset, some of it exacerbation. But that's a really significant number. And more importantly, not only is it affecting all age groups, it's affecting our youngest the most. The young adults, those 18 to 24, are experiencing a 75% increase in mental illness during this time. And 1 out of 4 of them are actually endorsing suicidal ideation. We have seen suicides increase significantly during this time. And we, just in Chicago, DuPage County, 23% increase in mental illness. In Cook County, suicide rates have gone up. And we know that there's great disparities in that as well. Disparities among African Americans who are at greater risk, much greater risk in the Cook County area for suicide, just because of the pandemic. So we are seeing so much that is clearly showing a sign that we are in a mental health crisis. So what that means for us is that we have got to think about how to protect our mental health during this time and how we can see the signs to get the help we need so that we can be resilient during this time. So I want to take a moment and just talk about, well, what is mental health? What does it mean to be depressed, anxious? How do you recognize the signs? Well, mental health is about how we think, feel, and act. And I like to think of it as we're all trying to maintain our mental health, no matter if we're in the pandemic or not. And we all do things to calibrate it. Can't do the same things anymore, but we can do different things. So mental health is, okay, you have a bad day, child comes up to you, you've been having a rough day at work. And in this e-learning environment, you've also been trying to maybe help your kids or become a teacher at home. And so you're overwhelmed. And kid comes up to you and is asking you another question after this very rough day. And you snap, you just can't take one more thing. Well, that means you're not really at your best mental health state, but we all have those days. That's okay. You might say, okay, I'm having a rough day. Let me take a moment. I'm sorry I snapped. I'm sorry I yelled at you. Let's sit down and work on this together. And that's perfectly normal. We're all having some days like that, and that we were having days like that before the pandemic. Might be having them a little more frequently, but that's okay. It's when you get stuck in that space where you're just not able to come back from that. You're always irritable, always on edge, you have no patience. That's when you should start to get worried, because the bad days should not be persistent or chronic. They should, you should come back and be like, okay, well, maybe tomorrow's a better day. So when we think about the anxiety that is going on in the pandemic, let's talk about that for a second. Anxiety is normal. Again, perfectly fine to have anxiety. We need anxiety. We survive in some ways because of anxiety. Anxiety helps you meet a deadline. You feel like something bad might happen if you don't, so you meet that deadline. Anxiety is walking down a dark street, especially as a woman, and you could be in a nice neighborhood, doesn't matter, you're just walking down a dark street, but you hear something behind you. You're gonna feel your heart race a little bit. You're gonna feel your ears perk up. You might clutch your bag. You might get prepared to run if you need to, or fight. You fight, the fight or flight. And that is normal. But as soon as you turn around and you realize, oh, that was a cat, or that was just the wind blowing some leaves, that anxiety comes down. And that's normal as well. But what we've been experiencing in the pandemic is that our anxiety back in March raised up here because we were being threatened by this unknown, invisible enemy. And that threat has had us, wearing masks and distancing ourselves and being isolated. And we're here with the anxiety, but it never extinguished. It's never come down because we're still waiting for the pandemic to be over. And that type of chronic anxiety can lead to mental illness if we're not doing the necessary things to take care of ourselves and to combat it. Even if you're feeling, overall pretty privileged in this time, you're still dealing with the anxiety of waiting until this is all over, until you can get back to your usual pleasures and spending time with family and enjoying your life. So what does it mean to be anxious in a way that's pathological or have depression? Anxiety is what you feel, again, it's that heartbeat racing and it not coming down, or it's the heartbeat racing at times where you're feeling panicked all of a sudden. Sometimes for no reason, nothing's triggered it. You just feel panicked. Your hands are sweating. You feel like the room is closing in. This could last for 10 to 20 minutes. That's what we call panic attacks. And panic attacks can come from chronic anxiety. Chronic anxiety can also be just feeling chronically overwhelmed, like you're worrying about everything. Your mind won't stop racing. You can't stop ruminating. And you're just replaying things over and over again. Excuse me. And also, you can't concentrate. You can't get things done. You may not be as productive at work. Because your mind is racing, when you go to sleep, you can't sleep. These are the signs of anxiety. But what's most important, what lets you know that this is a time to get help, is that you're experiencing this more often than not. It is now starting to affect how you interact with your children, your partner, your family, even on Zoom. Maybe you don't even want to talk to people that you love and care about. It's preventing you from getting things done at work and completing your tasks like you normally would. It's time to seek help if that's the case. Chronic anxiety can lead to depression. So depression is when you're feeling down, but you don't necessarily have to have anything to be sad about. You might have something to be sad about, you might not. Either way, it could still be depression. It's a lack of interest in things that you would normally enjoy. And yes, things have changed for us. So the things we would normally enjoy, we might be interested in them, but we can't do them. But even an inability to find new things that you enjoy, just an inability to perceive pleasure. A lack of appetite or eating too much. And I know some of us can relate to that during this pandemic. Eating too much carbs in particular, it's fine if you're eating healthy foods, but if you're feeling like, all I want to eat is sweets and breads and pastas, and I'm eating them excessively and I'm gaining weight, that's another sign and symptom. Feeling completely fatigued and exhausted all the time. Those are the types of symptoms you have to look out for, in addition to worthlessness, guilt, hopelessness, or feeling suicidal. Just thinking, gosh, if I didn't wake up tomorrow, I would just feel better. All of those things are signs to get help, especially if you are, again, experiencing them more days than not, and it is impairing your ability to function. So what can you do? Besides seeking help if you are experiencing any of those things, the things you can do to maintain your wellness, to maintain your mental health, is to, number one, self-care. I can't stress this enough. I say this to my patients all the time. And I hear all types of, some people are doing great and others are telling me, well, how am I going to do that? I have this from 8 to 5. I got my kids. At 7 to 8, I have this. And I'm telling people, I get it, but we got to set boundaries at this time if we want to be resilient and bounce back from this. You have to find a way to set boundaries so that you can carve out time for yourself, where that individual self-care can look like meditation, just a quiet moment. Maybe you read, maybe you take a walk. Ideally, you include some exercise in there somewhere. Meditation or self-care should not include increasing your alcohol intake, for instance, which is a coping mechanism that a lot of people are using right now. A lot of people are smoking marijuana, using more CBD. And those are actually a slippery slope for this time. So I encourage you to use natural things such as exercise, walks, meditation, yoga. It's also taking out of or reducing in your life things that deplete your reservoir. I think of it as a reservoir in your body. There's things that deplete it and there's things that fill it up. And you want to fill it up as much as possible with things that help you feel good, help you recover, help you be rejuvenated. And you want to minimize as much as possible the things that are depleting you. So think about that. And the other thing is really giving yourself grace, being kind to yourself this time. You won't be able to get everything done. You won't be perfect. You have to accept that you can't control this environment. And the better you can accept that, the more likely you will have less mental anguish around the times we're living in. All of these things help us to be resilient. Resilience is about not being broken by the circumstances we're in and being able to recover and bounce back. It doesn't mean that we won't go through hard times. It's all about the recovery. And the reality is mental health is a huge part of that resilience. So all of the things I've just stated, which is not an exhaustive list, are things that help you with your mental health, but ultimately help you stay resilient. With that said, I want to turn over things to Erin, and I would just close by saying that Helen Keller says, although we are in a world that is often full of suffering, we are in a world we are also in the world full of overcoming that suffering. So we have got to remember that we are a resilient species. We have overcome many things in many centuries and decades before, and we will overcome this.
Thank you so much, Dr. Clark. We appreciate you. Thank you so much for that insightful conversation. I do want to start off with some questions. At this time, I really encourage our audience as well, should there be any questions that you might have, let us know in the chat box and we will allow space and time for your questions. I will kick us off as we're waiting for folks in the audience to respond. Dr. Clark, what would you say is the mental health impact on the actual survivors of COVID-19? Are you seeing specific ramifications from the illness impacting people mentally?
Yes. So first of all, we're not talking about it enough, but in the hospital, a lot of people who have the COVID infection are delirious. And that delirium basically is a waxing and waning of their attention and kind of they're being in touch with reality. So we see hallucinations, paranoia, emotional distress, agitation, being present in some moments, kind of like you know, what you see in Alzheimer's where people are having lucid moments and then them being the next moment not being able to even say where they are, what's going on, being completely confused and disoriented. That in itself is a lot to manage. And then as they recover, I've definitely seen more sensitivity, more lability, meaning more tearfulness and sadness as the aftermath. And I think we don't even fully know the breadth of what the mental health toll is from just having had the infection. And we probably won't know until, you know, probably a couple of years from now. But these are what we're seeing, things that we're seeing right now.
Thank you for that. And for those who may have already been struggling with mental health prior to experiencing COVID-19 or any of the other traumas that we've been faced with over the last 9 to 10 months, how is that manifesting even more so in their lives?
And just to clarify, Erin, manifesting more so in
mental health, anyone that's kind of struggling, was struggling pre-pandemic with mental health, what are you seeing with folks like that, and are they seeking help?
Yeah, so it's a spectrum. There are definitely some people who are doing better than others. And I would say that the things I just talked about, that self-care, the people that are doing well are doing those things. They are setting boundaries. They are exercising. They are, you know, going to sleep at a regular time, maintaining daily schedules. With all of those things are extremely important. But there are plenty of people who feel, you know, beyond people who have just dealt with significant loss, such as that of a job, a house, you know, several family members even. You know, they're definitely dealing with a lot of and they've had mental illness before, so this is a major trigger. But we have people who were actually well before the pandemic, you know, with their therapies and treatment, and this has been a huge trigger for more of them than not. And some of it is them not feeling like they have any control and having a hard time balancing their lives for one reason or another. So it's been we're seeing so many more people coming in for acute episodes and acute worsening of their symptoms that I can't even keep up with my schedule here. You know, I'm booking people at this point at least 3 months out, and I'm still finding emergency spots here and there and plugging people in. So.
Thank you. I was asked a question privately that I will share. A member of our audience would like you to comment on depression or mental health leading to someone cutting themselves.
Yes. So often, you know, for those of you in the audience who are not familiar with the behavior of cutting, people who cut themselves are often doing that as a sense of relief. And what they often describe is that just that cutting helped them to relieve tension and anxiety and distress that they're experiencing. And why that particular behavior helps them so much, it's unclear. There's definitely something going on in the brain, but the way we see it with depression is that the depression is weighing on them so heavily that they use the cutting as a coping mechanism and a way to feel better. And it's so important for cutters, as we call them, to get help. It's really, really important to get treatment for the depression so that that cutting behavior can be decreased. And often these are not patients, just to be clear, are people who are trying to kill themselves. They might have cuts all up their arm, legs, maybe in discrete locations where this is just a coping mechanism, but definitely can be treated by getting help for the depression.
And then I'll ask a final question, and I'll open it up to our audience as well. During this time, this pandemic time, you mentioned this in your presentation that so many of us are dealing with grief from the loss of a loved one who may have passed away as a result of COVID-19. How do you recommend folks, what kinds of strategies or ideas would you have for someone who's trying to balance coping with death?
Yes, so and this is definitely been a hard adjustment for many who have lost loved ones or friends, or even trying to support someone through this. First is just letting yourself feel the emotion. It's okay to be angry that you can't grieve in the way we're used to, going to a funeral or being at the bedside when a loved one is sick and later passes on. But accepting that emotion, not avoiding it, letting yourself feel it, letting yourself be upset, be angry, and go through all of the stages of grief, which may take some time. And to be honest, because of the pandemic and because of the lack of ways to have normal closure, grief is taking longer than it has in the past. So be aware of that, be knowledgeable about that, and let yourself just feel what you feel and try to, grief should not be that you're feeling terrible every day. It should be more like you feel bad, maybe worse early on, it gets a little bit better, but it still comes in these waves, and those waves may come for months, and that's okay. Let yourself feel that, and when you can, try to do things again that are self-care, and that allow you to enjoy other things that you can.
Okay, great. So we have a lot of questions coming in from the audience. The first question that we had come in was, what are some ways people can generally seek support and community now that it seems harder to access?
Yeah, great question. And actually, don't think I mentioned this. That's another great way of maintaining your mental health is staying in touch with your circle of trust, the people that you are really close with and feel comfortable sharing whatever with. And yeah, it's hard to get together as the world, or at least Chicago, is starting to get colder. You may not want to stand outside talking to people, but doing Zoom is still a good way to connect with folks. You should be connecting with your friends and family regularly. I'd say daily. Schedule it in if you need to. Definitely on weekends. Do not go days without speaking with someone that you care about, especially if you live alone. And I would say, there's lots of different platforms now. There are all types of creative ways. You can watch movies with friends on, on different media platforms, so that you're watching it at the same time. You can hear, I think it's called Rave, where you can hear each other and comment and talk as if you're there together. And there are opportunities to get together safely outside. I definitely recommend doing it. I've definitely done it because sometimes you just need a person who's not on a visual platform. So, and that's okay too. So an idea is go for a walk with a friend, wear your mask, and, be outside. If this weather hasn't gotten too frigid for you, go for a walk today. Those are the types of things you need to be doing and scheduling in regularly, not once a month, but, weekly.
Okay, great, thanks. And next is, what is the best way to consistently make self-care a regular practice?
Daily setting aside, if it's 5 minutes, if that's all you have, set aside that. Of course, a little bit more will be better. I recommend 20 to 30 minutes at minimum each day, and scheduling it in. If you have a pretty busy profession or just a busy day with other things you're doing, e-learning, what have you, schedule it in, and don't make it like a meeting that you can't miss, and take that time to, meditate, do yoga. Meditation is actually quite good right now. And I can't stress it enough, because I was not the person who would have thought mindfulness worked for me. Because early on, people who definitely have a lot to do, you feel like, okay, my mind is just racing. Why am I doing mindfulness? But it takes practice and is actually quite effective for this current time that we're in.
Thank you. So next is, how would you recommend we best support loved ones who might suffer from pre-pandemic mental illness, but are deflecting and using COVID as an excuse to hide? A year plus is a long time to go without seeking help.
No, it absolutely is a long time, and too long. By that time, it could be in critical condition as far as, feeling suicidal or something like that. So definitely checking in on them regularly, but also encouraging them that they don't have to, go into an office. They can actually do this virtually. Most therapists and psychiatrists and counselors are actually seeing patients remotely. So it's not like they have to say, well, I can't go in because of COVID. I'm scared of it. They can see someone virtually, but also, if they're trying not to see somebody, we'll really keep pushing and gently nudging, but checking in with them, reminding them that there are options, and not giving up on them.
Great. And what have you seen in terms of the mental health impact of working from home for such an extended period, even if an individual has not been exposed to COVID?
Well, it's rather isolating for some, and for others, it's just, it depends on how many people are in your house. So, if you and your partner and kids and the dog and the cat live in the house, and you're there all day and everyone's trying to do their Zoom meetings and e-learning, and it depends on the space you have. So it's quite individual, but a lot of people, as you guys might be aware, a lot of people who have the privilege to move around right now are moving around because they don't feel like they have adequate enough space to feel comfortable. But there are plenty of people who can move around. So they're in a smaller space, probably never even appreciated that it was that small. It feels a lot smaller now. And they're trying to navigate getting everyone doing what they need to do, and that can be overwhelming and anxiety provoking. And so I encourage people in that situation to, you carve out, you just got to sit down and come up with the best plan you can. Accept that it is what it is. That's what you do first, accept that it is what it is, and then come up with the best plan you can to utilize the space that you have, then the resources that you do have, but also maintaining a regular schedule. I can't stress how much that I hear from patients who are now staying up until 3 a.m, and then, the sleep cycle is completely off. The kids are on this kind of random schedule. They just got out of bed. Now it's time to get in front of the computer. So I stress, normal stuff, eat breakfast, showering in the morning, getting dressed, having a plan for your day, having a stop time, setting some boundaries, having a bedtime. All of those things are extremely important for people who are working remotely exclusively.
Okay, are there gift ideas to promote wellness?
Gift ideas, that's a great question. So I can tell you some things I've thought of. And I say this with a caveat, because I'm, not trying to promote coping by drinking wine, but there's like all these virtual wine tastings now, and actually have a birthday coming up, and my best friend was telling me about some virtual wine tastings. But when I got to researching, it's like, oh, this is like a whole like world out here, you know. So activities is basically my point. It doesn't have to be wine, but virtual activities that they can do that might be fun, you know, depending on their interest. Also, book mindfulness things that are being sold online. There's a lot of like cool apps, and some of them do cost. So cool programs, so something like that. Reading, if you have a friend that likes to read, I think that's a great time to really indulge in reading and books. So an Amazon gift card is really like at least a gift I've given out. And I think that those would be the things that come to mind first.
Okay, thank you for that. Next is one thing I'm noticing is that when the pandemic first started, many of us responded by wanting to connect all the time via Zoom, Teams, etc. But now it can feel like too much sometimes. How do you find a balance between connecting with others, but also taking some time away, and especially away from the video screen?
Yeah, no, great. And you know, again, some of this is individually dependent on, you know, what your circumstances are. But I recently have been pushing my team to set a 50-minute limit on Zoom. I'm like, it's back to back where you don't even have time to run to the restroom. You don't have time to grab a drink of water, stretch. You're just off on, off on. So really setting, you know, some limits around Zoom itself. You know, if you can't dictate the length of the meeting, if you know, even if you don't have to stay for the last 10 minutes and can get off, that helps. But also, again, you know, if you're at the end of your day, you are zoomed out, you know, you might get together with someone for walking outside with your mask on. You might set some quiet time for yourself, and maybe you resume meeting up with family and friends on Zoom or another platform. I don't know if I don't necessarily think it feels different depending on the platform, but sometimes I'm like, okay, I'm tired of Zoom. I just want to hit FaceTime or WhatsApp or something. So maybe you even switch up the platform. Maybe you spend some time texting that particular day if you're just tired of being on the visual screen, and that's okay too, as long as you're finding a way to connect.
Okay, great. Have people suffering from an addiction, even a mild one, is there such a thing experiencing greater stress and trying to get clean?
Yes, it is. Because you're those who are dealing with addiction, it is really, really a hard time. And so if you know someone that has been sober, maybe even just recently, or has been sober for years, this is a difficult time, especially if they're left alone a lot, kind of with their stress and no way to really relieve it in, like I said, in the ways that we would normally cope, like getting together with friends or going to do some activities or hobbies they're used to doing but now can't. So it's definitely harder, and I recommend anyone who is sober, or especially if it was recent, to be in touch with if you like AA meetings, be in touch with a sponsor. Get a therapist at this time. You can be proactive. I would not wait until the cravings have come back or the temptations to use, whether it's alcohol or other substances, has returned, or until that sobriety has been broken. I would get help now and be proactive about staying sober. So, because it's a slippery slope. Definitely people who start back up, it's that much harder to, you know, come home and then not do that thing.
Okay, what could I do if I live in a toxic household when the people who I live with don't take into consideration the trauma that I have been in? I can't communicate with them how much worse they are making me feel without being gaslighted by them.
That can be very hard. And so I definitely empathize with that situation. But I would definitely stress getting some outside help, a therapist that can help work through how best to regulate your own emotions, because clearly you can't control or change the people you're living with, but you can change how you respond to them and how you let them trigger you. And that does, easier said than done, I know, but working with the therapist, you can definitely learn coping skills to prevent feeling gaslighted, even if that's what your family is trying to do.
Okay, how can we provide support to family members or friends who have survived contracting COVID?
Yeah, I would first say don't abandon them. There's, I think earlier on, it's like, oh, you got COVID, it's like the scarlet letter or something. And it doesn't mean you go sit there with your mask off and, hang out, but keep checking in on them. And, you can always drop off groceries or things on the porch and let them know that you're there and you're thinking about them. You can also, just FaceTime, do the normal things to make sure they're okay. But again, don't forget that they're out there quarantining and trying to recover.
Okay, those who work directly with survivors often struggle to show up and be present with them, especially if they are dealing with their own pandemic-related mental health. What are some best practices for direct service staff to implement in their daily work?
Yeah, no, that's a great one. It's really hard right now for those who are on the front lines in whatever capacity to make work feel less stressful, for lack of a better way to put it. So it's really about doing things once you get home, and same things, really that self-care becomes extremely important, and making sure that you're taking time for yourself. Some people are inclined to want to work overtime. Some people have to, and some people are just doing it. And I say, if you can take time for yourself instead of taking that extra shift, so that you can regroup and recover. We are in a marathon, not a sprint. So it really requires that we are taking the necessary steps to go the long haul, instead of being only dealing in the moments of, oh, let me help, let me do more. You will burn out, and then what?
Are you aware of any medical professional advocacy being done to allow for loved ones or support person to be present with COVID patients? It seems that isolation once hospitalized and even in passing is so traumatic for patients, families, and mental health staff.
Yeah, no, it's a huge trauma, and no, I'm not aware of anything that is going on other than more use of iPads in hospitals, so the family can connect at least visually with their loved one. But because it's such a contagious illness that clearly we don't know how to prevent, or how to make, how to know who's going to get a severe form of the illness or not. It's really hard to have a family potentially exposed, and then walking around and potentially exposing others. So this is an extremely difficult issue. But to my knowledge, the iPads is the only thing that people are implementing more.
Okay, and we are especially concerned with the mental health of the medical providers in our community, especially the sexual assault nurse examiners who are witnessing so much trauma between serving survivors of sexual violence and working with patients who are battling COVID. How can we support them, and what systems are in place to support them?
I can tell you definitely at Northwestern, we have developed a crisis line for the professionals helping take care of people. And I think many institutions are starting to do that if they haven't developed one already. And it's kind of on call to get people in right away who are saying that they're, really having a hard time. I think the bigger issue is trying to help the professional realize that they are actually having a hard time. And because so often we're used to having to put on that strong face and not really deal with our own issues. And I talk to a lot of professionals about, okay, now you've got to do the same thing. Because I can tell you, we're all in this together. It's not like I'm experiencing a different world than anybody else at this time. And on top of that, dealing with seeing other people's pain and witnessing them in their most vulnerable states. So self-care, the best thing you can do is encourage them to be okay with the stress and pain that they're feeling and the emotions that they're having, and to seek the help that they need for themselves.
Absolutely. So if anyone else has any questions that they want to ask, go ahead and put them in the chat. And in the meantime, Erin, I'll turn it back over to you for any other questions you might have.
Thank you so much, Miranda, for your help, and Dr. Clark for your wonderful responses. A lot of the questions that I had also kind of in my queue to ask were asked in different forms throughout the Q&A period. So unless there are other questions being asked by the audience, we can probably begin to wrap this up. So thank you so much, Dr. Clark, for sharing your time and your expertise with us today. It's my hope that each of us leaves this conversation better informed and committed to our own self-care so that we can be better allies, friends, advocates, and supporters of each other. If you like what you've heard today and you would like to support our work here at Resilience with the survivors of sexual violence that we work with, please visit our website at ourresilience.org to either make a donation, to learn more about volunteering as a medical advocate, or to learn more about future events, trainings, and workshops. We also ask you to help us expand our network of allies and friends by sharing our emails and social media posts with your friends and colleagues. It's only together that we can create, excuse me, a world where the world that we all want to see, one free from violence and one in which we are all empowered to be our best selves. I thank each of you for joining us today. Look out for information regarding our next speaker series, which will be coming soon. I wish you all good health, take care, and happy holidays.
All right, happy holidays.
Thanks, Dr. Clark.
Thanks for having me.
Okay. How do I get up? Okay.